I just wanted to use this immigrant issue as an example of how we can craft a different kind of dialogue and discussion. So it always amuses me that a nation of immigrants has nerve to be upset about immigration, but you know, helping people to understand the historical nature of our country and what has happened with immigrants as they come over in different ways is useful. And even, for example, a few years ago, I was talking to some people from Mississippi that were doing some organizing around some right-wing legislation against immigrants, and you know, and what they did there is they spoke in the African-American communities with the blacks about the huge internal, it's one of the largest immigrations, even though it was an internal immigration, in our country's history of blacks from the deep south to the north. So, you know, there's really a possibility for almost any community to have a different kind of organic connection about what it means to uproot your family and travel to a different location in an effort to better yourself. And we see, you know, with all due respect, brother, I don't give a shit who's in Washington. I mean, I do care, but I mean, the fact that they don't have enough sense to do anything. So I think it's great that Brother Chuy Garcia spearheaded that local ordinance that now prohibits the sheriff, he was supportive of this, of course, from turning over people who are here without documents that immigration wants just because they get arrested for drunk driving or some other thing. Yeah, oh no, Chuy is a county commissioner, I know, but so, and the sheriff supported it, is my point, otherwise it probably wouldn't have happened. But my point is, so here's a local action, and we're not by ourselves, other places are doing this, where the federal government used to say, hold these people, they're on our list, we'll come and get them in a couple of days, and mostly deport them. And so now we've locally said, no, we ain't doing that, okay? You didn't pay for it, we don't have to do it, we finished with them, that's it, you know. So it's possible at every point, whether it's trying to make sure that kids get in-state tuition at our state schools, or whether they're eligible for scholarships, we don't have to wait until there's some big legislation in DC. Obviously, we will have to get there at some point. There are things we should look to do locally that can address this particular issue and all other issues.
Just want to remind people and comment on one thing. OSHA has a role to play, but we're pretty much in the dark in terms of knowing where the migrant community is working. Work sites under 10 employees don't have to keep records. Even the example we had here on the person falling would not have had to been reported to OSHA because it wasn't a death. So I don't know whether we knew about that and investigated it or not. What we need to do is, again, get the community involved. And certainly we need to be careful, and we don't advocate that workers necessarily file complaints because of the retaliation that occurs. But organizations such as are represented here can file complaints on behalf of workers as representatives of workers that we can act on. We do need some kind of legal reason to go in and do an inspection. Many places do make us, not many, but a number make us get a warrant anymore, and so we still have to be careful about that. So we need some kind of person saying, I know that person works at the plant, they've told me there are problems, and we can count them as a representative of employees and then go and do an inspection without the name of anybody being involved. So we need to hear about it. We don't, the reporting requirements are minimal, only when a fatality or 3 or more people are hospitalized. Other than that, we're not going to hear about it. The data that we get that allows us to try and target some of the higher hazard workplaces only goes down to work sites of 20 or more. So there's a whole group, maybe even the majority of workplaces out there that we don't have any data on. And only by educating the community groups and trying to get them actively involved and channeling information into us, if we can be of help by going out trying to get something corrected, can we do something? But we need input. We need to know where these issues are occurring.
I just think it's important for folks to know too that it's important that when we speak about this publicly as well, that we're making sure that organizations and you know like OSHA, like that they're properly funded. All right, that's a big problem. sometimes where you have folks that are supposed to be doing things, and it's great with their mission, with their charter, everything that they're supposed to be doing is great, but we got to make sure that they have the wherewithal and the funding to execute and carry out their goal and their mission. And I agree with what you said about, locally we need to be doing stuff. That's what we can control, the stuff in our zip code. So I agree with that, but we also need to make sure that we keep calling on these folks to make sure that they fund properly these groups that are supposed to be looking out for these violators, and if they have enough inspectors and they have enough folks that can go out and carry out the mission. It's important.
So you have to come up to the and then I think we'll wrap it up and people can talk informally.
And let me underline something I think that is obvious given the composition of the panel, but there's no such thing as health and safety without self-organization and unions to represent the workers, because in every situation where the retaliatory firing occurs, it's because there is no union to protect the workers' rights. And it's appropriate to say that here at the University of Illinois, while there is the organizing efforts for the faculty and perhaps for the medical center as well. So we applaud the union representatives here because they guarantee the rights and secure the ability for the government to come in. Thank you.
Okay, Myra, I'm sorry, I didn't realize you had a comment.
Just a quick comment on Jorge's comment about funding. I mean, right now, this super committee in D.C., there is about to be huge cuts. I think OSHA, you were saying that probably be a 10% funding cut. Hopefully it could be limited to less than that, but I think that as much pressure as all organizations can put on putting, securing funding, keeping funding, increasing funding, if that's possible, for worker health and safety, and for things that are really helping our communities, this is a time for that pressure to build. So.
Okay, I want to thank everybody for participating, and especially our panelists here. But before we leave, I'm going to invite Lisa Lee, who's the director of Hull House, to come up and welcome you and to introduce a little bit about Hull House before we move to the next part of our program.